All right. So today we're going to be covering how to access DHIN's personal health record, Health Check Connect, and how patients can use it to track their medical information and look at things like their labs and summary of care documents and things like that. So for the patient to log on to the Health Check Connect portal, they can go to mydhinphr.com. As a practice, part of the practice bundle with DHIN, you have access to personalize the PHR. So you can actually get a custom URL with your logo here. So from the patient perspective, they would actually see it as your personal health record that you're offering to them, but it would be filled with data from DHIN. So any questions on how to sign up with that, let me know or contact your business relationship manager or the service desk. Today, however, we are going to be using a testing site of Health Check Connect. So it's all going to be test data, no PHI or anything like that we're looking at. For a patient to sign up for Health Check Connect, they would go to the login page, but instead of entering their username and password, they would go down to the bottom left and there's a sign up now button. So they can click on that. This is a test version. So they would accept the terms and conditions. And then they would create their username, their password, and enter all their personal info. From there, they would receive their login credentials, their confirmation, and be able to log in from there. But I'm going to go ahead and go back to the login page here and log in. All right, so this is the first page you come to in the personal health record. This is the patient dashboard. So the dashboard shows the patient's name in the top left corner. We also have a number of widgets. Each widget shows the three most recent items for each category. So you can see the three most recent medications that the patient is taking. And this is all the patient view again. So this would be that patient's medications, that patient's procedures, that patient's blood pressure, and so on. These widgets can actually be customized in whatever order the patient wants to view them in. So if they wanted to change their view, we can go up here to settings, click on widgets, and they can reorder the widgets to whatever's most important to them. So if they wanted to see lab results first, they can drag that to the top. Same thing with appointments. If they didn't really care to see something like if they didn't really have anything they were allergic to, they could remove allergies completely or sleep completely and take that off the list so they don't have to see it. Once they make their adjustments, they can click the Save button. And then their dashboard is now customized to their liking. On the left side, we have a little toolbar here, and we're going to work our way down the toolbar. But beneath the dashboard icon is the health timeline. Here you can find different documents that were sent in for the patient. So again, most of this is test data, so some of it's not going to come up, but this is where you'll see things like care summaries. You can see things that were added to the patient's chart, like ambulatory visit, any vitals that were taken at the visit, things like that. Beneath the health timeline, we have the health profile. This is where you can see a lot of the health data that's going to be in the patient's chart. So a lot of the widgets that we saw on that dashboard page, it pulls from this page here. Again, the dashboard was only showing the first three or the latest three items. This is where you can go to see a more broad history for each category. So you can choose which category you'd like to view. If we go to lab results, you can see all the labs that the patients had. You can click on a lab to see more information. And then you can actually print it out if you want. We can click the print button. We're going to get a little preview. of the printed version of the lab. And then we can decide if we want to actually print it out or we can download it as a PDF onto our computer. But once you made your choice, you can go ahead and close out of that. And then we're back in the chart. So some of these categories populate automatically through interfaces from DHIN. So the lab results, they'll come directly from DHIN data centers. So hospitals and lab facilities throughout the state are going to be populating this field. But other categories are tracked by the patients themselves. So you can do things like exercise. You can track your exercise, if you went on a bike or a walk or what have you, you can track that here. You can also track your weight, your height. And with a lot of these different trackers, you can view them in a list, or you can click this graph button and it'll show you what your weight is or whatever the category is over time in a graph. For this particular one, we can look at weight, or we can look at the BMI for the patient and see how that's improved. All right, moving down on the toolbar, we're going to go down to My Health Files. This is a tab that's currently being worked on. It's being enhanced, but this is another place where you can find things like care summaries for the patient. You can click on one to view it. And then if we wanted to print it out or download it, we have those options up here. Next, we have a Messages tab. So Messages is a place where you can actually, as a patient, the patient can send and receive secure messages to their healthcare providers. So when a patient signs up for the DHIN personal health record, Health Check Connect, they receive their own direct secure email account. And we can see that by going to the top right corner here, clicking on the patient's name, and then click on My Profile. And then we have the secure email address up top here. So for this patient, it's bjones123 at replacethis.dev.medici.us. So the patient can use this address to communicate with their healthcare provider. We have some pre-filled messages that the patient can generate. So if we want to do like a refill prescription, we can click that refill button. It generates the subject and a message for the provider. The patient would just replace these little parentheses with the provider's information. The patient would need to know the provider's direct secure email address. If they don't know the address, we do have a directory services tab. So I'm going to jump down a little bit here. And you can actually do a search to see if we have the provider's direct secure email address in our system. So you can search by provider name or by organization. Let's do primary care. All right, we're going to go a little more broad here. All right, so we have several offices throughout Delaware that are in our directory. So let's say ambient medical care. You'd be able to click on that organization and see their contact information. Again, this is a testing site, so we don't have their actual information in here, but the patient would be able to see their contact info when they click on their name. All right, we're going to jump back up to My Appointments. And this is basically a calendar that the patient can use to keep track of their medical appointments or any appointments that they'd like to keep track of. So you can see here, we have a checkup tomorrow. You can enter in the location, the practitioner name, priority, description, and whether it's active, completed, or canceled. Same thing here with to-dos. Patient can use this as a calendar for various medical to-dos that they have coming up, just to help them keep track of things. All right, and we're going to jump down to My Apps. So Health Check Connect can actually interface with a couple different health tracking apps. So Fitbit and Apple Health. Any patients that use those devices or apps can sync the data that the app tracks with Health Check Connect. So they'd be able to connect that account to Health Check Connect, select a date range that they like to import the data, and then they would go ahead and import. And it would import things like their sleep, their exercise, their steps, their weight, things like that, all within Health Check Connect. All right, down here we have history. History basically shows a history of what the user has done within Health Check Connect. So you can see results that they've read, searches that they've done, if they added any information to the various categories, you can see all that here. All right, towards the top of the page, we do have patient educational resources. Patients can search for medications, medical conditions, and just get a little more information on those. So if I were to type in, for example, ibuprofen, let's see if I spelled that right. Almost. All right, I get a list of articles to choose from. I can click on an article to read and get a little more information about that drug. The patient can then save the article or print it out if they wanted to. All right, so that is Health Check Connect. Again, this is something that's offered as part of the practice bundle. Patients can sign up at no cost. As a DHIN customer, if you're part of the practice bundle, you can take advantage of getting a customized version with your logo that you can offer to your patients. Any questions on how to sign up for that, how to take advantage of that part of your bundle, feel free to reach out to the DHIN service desk or your business relationship manager. Thank you.